but that's where you're at. And you still have some minimally invasive, easy surgical, I wouldn't call them easy, you have some minimally invasive, reasonable surgical options to go through that are going to get you back to being active. So I'm going to quit talking because otherwise we'll put everybody to sleep. And I want to just open it up for questions. Let's just start over here. Go ahead.
Could you comment on Baker's cyst?
Yeah, his question was a Baker's cyst.
And also celiac disease.
I'm going to skip celiac disease because it's a little controversial on how it's going to affect your joints. So I think it would be better discussion maybe one-on-one afterwards. Baker's cyst, super common. A fullness at the back of your knee. Almost always a Baker's cyst is as a result of a meniscus tear inside the knee that has opened up the back of the capsule of the knee and caused fluid from inside the knee or inflammation from inside the knee to leak into the back of the knee, and it gets trapped there. So the treatment isn't to treat the Baker's cyst. The treatment is to treat what put the fluid there. Because I can go in and dissect out the Baker's cyst and remove it beautifully, and it'll come right back. So you can't treat a Baker's cyst until you know where the fluid came that got there, and it's almost unanimously from a meniscus tear. And you might have some arthritis also causing some inflammation in the knee that's filling that cyst. Yes?
I heard about plaster replacement, and I was wondering if it's the same as cartilage replacement in the hip.
You said...
They take plasma. Apparently they take your blood and they remove the plasma and they throw it and they re-inject it.
I'm going to answer it in the best way I know. One of the common treatments that we're looking into early injection therapy for arthritis is called platelet-rich plasma, PRP. We use it in sports medicine. Heinz Ward got it in his MCL right, the week before the Super Bowl, so it became a huge thing as soon as that happened. I always say there's no real disease till it happens to a celebrity. So basically, PRP came to the forefront, and there's some early studies on using it for arthritis, so I wouldn't use it as one of those arthritis injections that I talked about because it's just way too early. I do use it, well, let me tell you what it is. We spin your blood down and get the layer of platelets out, and the platelets are rich in growth factors that can create a healing response. So I use it in tissues that have a poor healing ability. So if you have a chronic tendinitis, it has already been shown in nice studies that it can help your body heal that tendinitis. So say a chronic Achilles tendinitis, plantar fasciitis. Those are good options for it. I use it in meniscal repairs. If I have to repair a meniscus, I put PRP over it. So basically it's just a new technology that may stimulate a healing response. Help your body heal something that isn't going to heal on its own.
And one other question. Can you use the cartilage from the knee and the hip like your...
You can. I try not to rob one good joint to pay for another. But for example, in the ankle is a really common example. You can get some early cartilage wear along the edge of the ankle joint, which sees a lot of stress from weight. And once in a while, I'll take one of those plugs that I showed you from a healthy knee joint way out on the side through a very small incision and replace the damaged cartilage in an ankle joint. And then, back and forth for knee joints, commonly done. Taking it from the knee to the hip would be a little bit too, it'd be a little risky because it hasn't been proven. So if you have a cartilage injury in the hip, I would use that technique where we try and stimulate the bone marrow to fill the gap for us.
Could you please repeat the question?
I will. Sorry about that. Did you have a question up front? I'll get you next.
Cortisone shot in the hip once a month, is that acceptable?
I assume the cortisone shot is being done on the outside. Sorry, I'll repeat the question. Cortisone shot in the hip once a month, is that reasonable? If it's being done in the office, I can almost guarantee you it's being done on the outside of the hip joint for bursitis or pain that's on the outside of the hip into that bursa. I try and space out cortisone injections by 6 months, preferably maybe 2 months. And cortisone is meant to kick down inflammation, give you a period of relief, so that you can then cure the problem that caused that inflammation. I will use it to buy you time.
But it's not a permanent treatment.
It's not going to cure the problem, not in itself. It's going to decrease the symptoms and get things to a reasonable level. Now, bursitis can be treated with some physical therapy to stretch out that IT band, get the muscles around the hip stronger, your core muscles that hold your pelvis up stronger, and that IT band will stretch out and let the bursa get some relief. But if the bursitis is coming because your hip is so stiff that it doesn't move, the real problem is the hip joint.
To what degree is age relative in either a partial or complete knee replacement?
Great question. To what degree is age relative in a partial or complete knee replacement? Did I get it right? I would say it's not relative. Initially, we were doing partial knee replacements only on people, say, over the age of 70, because we were so concerned that, well, we're only replacing part of the knee, and is it going to last? How long is it going to last for? Well, I would say if you have a 45-year-old patient with bone-on-bone arthritis that's not able to walk around without pain meds or a cane or something like that, I would always take a partial knee replacement over a total to start with, even knowing I would tell that patient at 45, unless I get really lucky, you're not going to live your whole life with this partial knee replacement. But if I got you 15 or 20 years, and then you're, say, 60, and then you need a total knee replacement, that would be a great option. And then take, again, your example of a 65, 70-year-old patient. They only have arthritis on the inside of their knee. The pain is only coming from that part of the bone. Well, I would love to do a smaller operation, replace the part that's causing pain, and leave the rest. So you have to have the right diagnosis, and then if you're the right candidate, that's a great option. Age doesn't matter for me on that.